If you've ever wondered how many types of diabetes are there, then stay tuned because this video is for you. There are primarily three main types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. Here's an overview of each type. Type 1 diabetes. Cuz. Type 1 diabetes is an autoimmune condition where the immune system attacks and destroys insulin-producing beta cells in the pancreas. The exact cause is unknown, but genetic and environmental factors play a role. Onset. Usually diagnosed in children and young adults, but can occur at any age. Treatment. Requires lifelong insulin therapy. Often managed with insulin injections or an insulin pump. Type 2 diabetes. Cuz. Type 2 diabetes develops when the body becomes resistant to insulin, and the pancreas can't produce enough insulin to maintain normal glucose levels. It is often associated with obesity, poor diet, and lack of physical activity. Onset. Commonly diagnosed in adults, but increasingly seen in children and adolescents due to rising obesity rates. Treatment. Managed through lifestyle changes, such as diet and exercise, oral medications, and sometimes insulin therapy. Gestational diabetes. Cuz. Gestational diabetes occurs during pregnancy when the body cannot produce enough insulin to meet the increased needs, leading to high blood sugar levels. Onset. Develops during pregnancy and usually resolves after childbirth. Risk factors. Overweight, family history of diabetes, or certain ethnic backgrounds increase the risk. Complications. If not managed, it can lead to complications for both the mother and the baby. Women who have had gestational diabetes are also at higher risk of developing type 2 diabetes later in life. Other types. Monogenic diabetes. Caused by a mutation in a single gene. It's rare and often diagnosed in childhood. Secondary diabetes. Caused by another medical condition, like pancreatic disease or hormonal disorders. Prediabetes. Blood sugar levels are higher than normal but not high enough for a diabetes diagnosis. It increases the risk of developing type 2 diabetes. Most asked questions. What are the different types of diabetes? There are three main types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes is an autoimmune condition. Type 2 diabetes develops due to insulin resistance, and gestational diabetes occurs during pregnancy. How does type 1 diabetes differ from type 2 diabetes? Type 1 diabetes is an autoimmune condition where the body's immune system destroys insulin-producing cells, requiring insulin therapy. Type 2 diabetes is characterized by insulin resistance and impaired insulin production and is often managed with lifestyle changes, medications, and sometimes insulin. What causes gestational diabetes? Gestational diabetes occurs when a woman's body cannot produce enough insulin to meet the increased needs during pregnancy. It usually resolves after childbirth but increases the risk of type 2 diabetes later in life. Is diabetes hereditary? Type 1 diabetes is influenced by genetic factors, but not directly inherited. Type 2 diabetes has a stronger genetic link and can run in families. Gestational diabetes can also have genetic factors but is primarily influenced by pregnancy-related factors. Can diabetes be prevented? Type 1 diabetes cannot be prevented. However, type 2 diabetes can often be delayed or prevented with a healthy lifestyle, including regular exercise, balanced diet, and maintaining a healthy weight. How is diabetes diagnosed? Diabetes is diagnosed through blood tests that measure blood glucose levels. Fasting blood sugar test, oral glucose tolerance test, and HbA1c test are common methods used for diagnosis. What are the complications of unmanaged diabetes? Unmanaged diabetes can lead to various complications, including heart disease, stroke, kidney disease, vision problems, nerve damage, and problems with the feet and skin. Proper management is essential to prevent these complications. Can diabetes be cured? While there is no cure for diabetes, it can be effectively managed. With proper treatment, medication, and lifestyle changes, people with diabetes can lead healthy lives and reduce the risk of complications. Can diabetes be controlled with diet and exercise alone? For some individuals, especially those with type 2 diabetes, managing the condition is possible with a healthy diet, regular exercise, and weight management. However, many people also require medications, including insulin, to effectively control their blood sugar levels. How often should people with diabetes have their blood sugar levels checked? The frequency of blood sugar monitoring varies based on the type of diabetes, the treatment plan, and the individual's health status. People with diabetes typically monitor their blood sugar levels several times a day, especially if they are on insulin therapy.